You have been prescribed Eprex. Your doctor will decide what dose you'll require and how often you will need to inject Eprex based on your weight and how you respond to the treatment. Gathering your supplies, deciding where to inject, preparing the injection, and giving yourself an injection. Take the Eprex vial out of the fridge 15 to 20 minutes before you inject to give the liquid time to warm up to room temperature. You can hold the vial gently in your hands, but don't do anything else to warm it up. Do not shake it. Check the expiry date printed on the label. If this date has passed, don't use this vial. Instead, return it to your pharmacy. If this is the first time you are using the vial, write down today's date on the inside flap of the box. Look at the medication in the vial. If it's not clear or has particles in it, don't use it. As well as the vial of Eprex, you will need a sterile, disposable syringe, 2 antiseptic swabs, and a puncture-proof container for disposal of the used syringe. Clean your working area as your healthcare professional has told you. Wash and dry your hands thoroughly. Choose the part of your body you plan to inject and expose the area. Use one of the areas shown in this diagram. If you are very thin, the abdomen is a better place to inject. Be sure to use a different injection site each time, as instructed by your healthcare provider. Pick up your syringe and check for breaks in the sterile wrapping. If there are any breaks, put the syringe in the puncture-proof container and get another one. Otherwise, unwrap the syringe. If this is the first time you are using this vial, gently remove the protective cap, making sure you don't touch the rubber stopper. Use one of the antiseptic swabs to clean the rubber stopper. Look at the syringe and find the dose you will be injecting. Take the cap completely off the needle, keeping your fingers away from the needle at all times. Then insert the needle into the vial, turn the vial and the syringe in it upside down. Keeping the needle tip covered by the liquid, pull back slowly on the plunger to draw the liquid into the syringe up to the mark indicating the amount to be injected. Hold the vial and the syringe with one hand and use the other hand to flick the syringe until any air bubbles rise to the top of the liquid inside the syringe. Move the tip of the needle above the level of the solution in the vial and slowly push the plunger to move any air out of the syringe. Double-check the dose. If you now need more drug in the syringe, move the needle tip back under the surface of the liquid and pull back on the plunger till you have the right amount. Then pull the needle out of the vial. Use the antiseptic swab to clean the injection site. With one hand, take a fold of skin between your fingers. With the other hand, hold the syringe like a pencil at a right angle to your body and push the needle in. Pull back slightly on the plunger. If you see any blood in the syringe, don't inject the Eprex. Discard the syringe and start again. When you're ready to inject, push the plunger all the way down. With the antiseptic swab nearby, pull out the needle and gently press the swab on the injection site for a few seconds. Don't rub the skin. Always discard the syringe in the puncture-proof container, and don't recap the needle before you put it in. If there's any medication left in the vial, it should be stored in the refrigerator until your next injection. Discard an empty vial in the puncture-proof container. And always keep the medication, syringes, and the container away from children. Be sure to read the patient information booklet in the Eprex Starter Kit for more information, or talk to your healthcare provider if you have any additional questions.